Welcome to Moms of the Lou, hosted by two fellow St. Louis moms, Rebecca
and Lauren,
and recorded for St. Louis moms.
Grab your laundry basket, kick your feet up for nap time, or head out the door for pickup, and spend a little time catching up with local moms who are making a big impact in St. Louis.
Let's dive into our discussion today.
This episode of the Moms of the Lou podcast is brought to you by Swap the Playroom. Parents, let's be real. How many toys have you bought that your kids got bored with after a day or less? Stop buying and start renting. With Swap the Playroom, you can clear out the clutter and still get toys that keep things fresh and exciting. It's sustainable, budget-friendly, and keeps playtime fun without breaking the bank. Give your wallet a break and your kids a whole new world to explore. Visit swaptheplayroom.com today and join the ultimate toy rotation.
All right, St. Louis moms, we're back for another episode of Moms of the Lou. Today, we're so honored to be joined by a new to St. Louis mom, Tricia McGusty, who is the new president of Mercy St. Louis Communities. So welcome.
Thank you. Very good.
We're so excited to have you here and to pick your brain about all things Mercy, mom life, all the things.
What it's like to move and start a job right away. So tell us a little bit about your background and where you're from and how you got to St. Louis.
Yep.
Absolutely. So I'm from Houston, Texas. I've lived in Houston all of my life. Mm-hmm. Well, I should say I lived in Texas all of my life. I did live in San Antonio for a hot minute.
Yeah.
But this is my first stint outside. This is the longest I've ever been outside of Texas.
Wow.
I landed in St. Louis on February 28th, and I feel like I went straight into the frying pan.
Yeah.
So my background is just in hospital administration, healthcare. That's what I do. I run hospitals, and I'm basically an empty nester. So when it was time for that last one to go off, I was like, okay, it's time to figure out what I want to do.
Wow. Yeah.
And I keep telling people, it's like, that game, I don't know, 6 degrees, 9 degrees of Kevin Bacon.
Yes.
Like how you relate everything to whatever it's called. Yeah. It's like every decision in my life can go back to my kids, right?
Yeah,
so
sure.
Every decision I wanted to make a decision for me. And so that's how I ended up here in St. Louis. I needed to do what filled my cup, and it was getting out of the for-profit world and going into faith-based, not-for-profit. So,
Awesome.
What drew you to Mercy in St. Louis?
So when I was making the decision, I was like, okay, I want to still run a hospital. Mm-hmm. It needed to be not-for-profit, needed to be faith-based. And then my husband travels for work, so I needed to be in the center of the country. Mm-hmm. So, and I've never shoveled sunshine off my driveway, so I didn't think shoveling snow off my driveway was like something I really wanted to do. So I wanted to kind of stay as far south as I could.
Yeah, yeah. How'd that work out for you in February?
Well, yeah.
Actually, you came at the right time.
January.
After I accepted the job, I feel like 2 weekends later, maybe, I told my husband, hey, you want to go up there? Let's look around. Let's figure out. And I remember eating with Dr. Miners at the Shack. And I walked in I'm looking out the window and I keep turning my head to the side. I'm like, what is that? And it's like this blizzard coming through. And I'm just like, the window's behind him. So I can't even pay any attention to what he's saying. He's like, what is that?
And how am I going to get home
and
safely?
How I'm going to get home.
Yes.
And my husband's like, please don't fall. Please don't fall. Please don't fall. Everywhere we're walking outside.
Right. Yes.
And he's like, well, it's good that you're seeing this now. Now you know what you're getting yourself into.
Absolutely.
So I think that was that snow. And then I think there was one other snow, but I wasn't here for that one.
Okay.
But
yeah, there's always a surprise snow. Something I've learned along.
But I feel like in the first 2 weeks that I was here, I saw all 12 seasons that you guys had to offer.
Very normal for St. Louis.
They were just trying to prepare you for what it actually is like here in St. Louis. The weather gods.
Yeah, it's totally.
It's unreal.
It's unreal.
The thunder here.
Yes.
The storms, that doesn't exist anywhere else in the world. I don't know if you've been anywhere else, but that thunder doesn't sound like that anywhere else.
We're so special and unique here.
I know. I'm from San Diego, actually. Okay. And my parents, when they come to visit in June, my dad is just flabbergasted every year. I've been here for 13 years, but every visit, it's like, what is that? And are we okay? Do we need to call 911? And and I actually really like weather now because it's just so different when you're used to growing up and the weather's kind of consistent year round. So I kind of like the seasons in St. Louis, but it does there's an adjustment period and you are safe generally.
The first night I woke up in the middle of the night because I thought the siding was coming off of the temporary housing that was in an apartment building, and the sounds that were coming from outside, there's no way this building's going to be here in the morning. And I looked outside in this courtyard, and it's just still. Yeah. Like the patio furniture hadn't moved. I was like, what is that noise? So
can be a little alarming.
Yeah, you'll get it all here in St. Louis. There was one day on spring break, we had like tornado sirens or alarms, whatever. Sirens, and it was also snowing, and then it was raining, and it was sunny. All in one day. It was just wild.
It kind of blocked that out.
I know.
No, a lot of cities say, just wait a while, it'll change. Y'all have that on lock. This is here. This is, it's like everybody else needs to stop using it.
Yeah. Okay, so you say you always wanted to run a hospital, and I just have to ask, it feels like that would be such a stressful line of work. And so what drew you to want to be in this work?
Man, yes, I've always wanted, like I knew I wanted to lead and do that. Maybe it's a stretch saying I always knew I wanted to run a hospital, but I knew I wanted to be in healthcare.
Yeah.
I thought I wanted to be a doctor, and then that whole MCAT and all that medical school, I was like, that's not for me.
It's not for me. Yeah.
And then wanted to go to nursing school, and then there was a class called pathophysiology. I was like, that wasn't for me either. So I just kept going, and I still got my degree in sciences because I loved science, and I just found this match, like being able to lead strategy and then be involved in. I'm drawn to healthcare, and I just like helping people, and I think you get to meet people in like the most vulnerable stages of their lives, and you get to make it better. And so that's what I like doing. I like being a fixer.
Well, you're a mom, so that's a good fit. So tell us a little bit about your role as you're going to tell me what your role is.
We'll just say I run a hospital. I run some clinics. I run some outpatient surgery centers. I think really it's not probably that exciting and glamorous. I do a lot of listening. That's what I do.
Yeah.
Especially right now, being new, I'm learning. So I go and I sit down and I talk to people and I listen, like what's working well, what's not working well, how can we. And I think experience helps you kind of solve problems a little faster. Being a mom helps you solve problems a little faster.
Absolutely.
So it's listening and trying to figure out how to connect what everybody's already doing to the strategy and where we need to go. And without complicating things.
Don't miss the Summer Family Fun Series at the Missouri History Museum. Enjoy free family activities every Friday in June and July from 10 a.m. to 1 p.m., featuring live music, performances, crafts, and the popular storytelling in the museum program. Each week features a different theme like music, Juneteenth, America's 250th birthday, and more. Appropriate for ages 3 to 12. Complete daily schedules at mohistory.org/summerfamilyfun.
What are some of your goals or maybe some vision that you have for Mercy as you get started?
Yeah, I think it's when I came to St. Louis, I know there's Mercy everywhere outside, even outside of here. It's like Mercy. Oh, that's a great place. Oh, that's a great organization. Oh, they're a great health system. Everybody loves Mercy. St. Louis loves. So I heard all these great things about Mercy coming in. And I think that as healthcare changes, we have to make sure we're changing with what our patients need and where they need it. I think the biggest thing for me is just looking at how we create access for our patients. As I was telling the team this the other day, as someone in healthcare, I can navigate the healthcare system. It's easy. I need an appointment. I can make a phone call and I can have an appointment this afternoon with any doctor, probably in any specialty.
Yeah.
That's not what it's like for most people.
Right.
I mean, you think about when you try to make an appointment and and then if you have to see a specialist and just how difficult access is, or so for me, it's how do we my goal is for the rest of the community to have that same access that I have, that I can do, that they're not sitting at home for weeks waiting to get that oncology visit or waiting to get their kid to the doctor for whatever it is that they need answers to. So I think right now we have some capacity issues, which is why we're trying to do a construction project. We need more space in our emergency room. We need more breast imaging centers for diagnostic mammograms. So it's just doing things like that, creating capacity. That's my goal. I get a report that tells me how long it takes to get an appointment, and I just want those numbers to be less.
Oh, I love that.
Cool.
Yeah, that's very cool. That's a nice finite, thing to work on. And parents, patients, mothers will all appreciate that.
100%.
Yes.
What is the renovation that you mentioned?
So the renovation, it's we'll call it a 10-year plan.
Okay.
How long it's going to take us to get there.
Yeah.
But it includes adding capacity in our emergency department. That when the hospital was built, it wasn't built big enough to take care of the amount of volume that comes through now. The emergency room is the busiest emergency room, and I think you have to go down south to Louisiana and go to it's like a huge capacity that we're having to take care of. And so we need the space so that we can do it more efficiently. So that's one. Adding imaging so that we can do things more efficiently. We need a new patient tower so that the building is old. It's been there for a while. So, but we can't just renovate those rooms. We have to build a new tower, and then we have to have the space to move those patients over. So it's doing things like that. In the beginning, it's a lot of just the readiness work, the stuff that nobody's going to see, moving wires and HVAC systems and relocating MRIs that nobody's going to notice for 2 years. But it's getting ready for the big projects. So
And how to do that seamlessly while you're still caring for the same
other
volume of patients.
That's a big undertaking.
Exactly. The prep part probably takes the longest of what entrance are we going to close? How are we going to route patients? And then how quickly can we get a patient that's having a stroke to the CT if we make this change? So you have to think about all of those things before we can even get to the construction part.
Yeah.
And that new tower, that will be Ballas?
Yes.
Okay.
Yeah.
Okay.
It will be on the Ballas campus, probably on top of the emergency department.
Wow. Wonderful. That's great news.
What I'm just thinking about this as I was on the phone yesterday, actually getting an estimate for my daughter's tube surgery, and have pretty good health insurance, but okay, there's a chunk that we're going to have to budget, Do you see a gap in what insurance companies are providing and what people have access to? And how do you think that we can make healthcare more affordable for Americans?
Yeah, there's obviously a gap. I think when you look at Mercy, it doesn't matter for us whether you have insurance or not. We take care of you. I think that as a mom, I'm navigating some of the same things that you're navigating with a kid. And it's insurance and what insurance will pay for and what the hospital is charging. There's definitely a gap. We have to figure out how to make sense of that. I think some of it is just educating some of the lawmakers too. And we've been doing a lot of that. It's making them understand why something does cost what it does and how do we get them to kind of come closer to what the cost of healthcare really is, and being able to provide that to everyone, whether it's behavioral health services or surgery or just a primary care physician. And I think there are things that we can do to make there are some things that can be more affordable. Now we have televisits. That's definitely
right.
more
Sure.
more affordable. We can do these things, and how do we move things into less expensive platforms so that we can leave the high acuity, more costly things at the hospital? What can we move out? And I think that Mercy does a lot of work with that, a lot of intentional work of how we can better manage the cost of healthcare and how do we keep you out of the hospital and at home. And I think that's kind of the work, and combining those two things that really has to be done.
That's so huge.
Yeah. You have to get creative.
Yeah.
Yeah.
Do you feel like our system in the United States, I was just talking to somebody about this, is like reactionary more so than like preventive? What has been your observation?
I think it's probably a combination of both. I think that we do a lot of great work with preventive care, and there's certain things that if you look at women's health and getting your pap smears and making it easy for you to get a mammogram without needing a doctor's order, you can go get that. So I think there's some things that we've done a really great job of telling the story of this is preventative, and if you just do this, this is how many lives it will save. There's a lot of more work to be done down the road. Some of it's a little harder, like colonoscopies.
Yeah.
Yes.
That's
on my radar.
A little more prep, and so it's a little more work, and sometimes those turn into reactionary because you've put it off for so long, or you have a friend that goes and gets one, and then the results aren't what they expected, and so now you're like, oh my gosh, I need to go get a colonoscopy.
Yeah, exactly. Yeah.
But I don't think that it's just one-sided.
Yeah.
I think we need to get to where it needs to be more preventative. Absolutely.
Yeah. I do feel like there's more preventative care, or at least that information for moms and families.
Summer should be spent outside, not battling mosquitoes or brown patch. Right now, Ryan Lawn and Tree is offering 50% off the first mosquito guard application and 50% off the first fungicide treatment application. Their Mosquito Guard program helps reduce mosquitoes around the yard so families can enjoy outdoor spaces again, while their fungicide treatments help protect lawns from damaging summer diseases like brown patch. Don't wait for the problem to get worse. Head to ryanlawn.com/STLmoms to request a free estimate and take advantage of these limited time savings.
Is there anything that you would say to moms to be like, if they could make one appointment this year, what would be something that would benefit them? Gosh, that's a big question.
That's a big question.
Take care of themselves.
Yes, it's just about taking care of yourselves, and it may not be necessarily in the hospital healthcare physician space. Maybe it's in the I need to go get a facial space. I don't know, but it's about taking care of yourself in general and making time. I think probably for a lot of moms, it's just getting out and exercising and finding time to do that for yourself. I know that for me, I used to work out at 4:30 in the morning because nobody was up at 4:30. Nobody
needed you.
Asked me to go for a drink at 4:30 in the morning. Nobody, was like, that's where I carved out that time to take care of myself. But I think that's, for me, I think it's about whatever that wellness or whatever spiritual wellness or care you need for yourself. It's going to be different for every single mom.
Yeah. I think that's so important for moms to know that. And so your life, I would assume, is just very chaotic and busy and new. How's that going for you in St. Louis? Has it been an adjustment moving from Houston? Do you need our help? Do you have
what are your initial observations?
It's definitely an adjustment. I will say that I thought coming here, and because I had kids, my daughter stayed back in Houston in the house with my mom, and my son's in college, the other one's in London. Like, I thought, I come here, it's going to be so easy to find somewhere to live. When you don't have guardrails, like school districts or how many bedrooms you need, or it's actually harder.
Yeah.
And so I really struggled in the beginning. I was like, oh, well, let's go look here and let's go here. Let's look downtown. Maybe we'll live in a high rise. Maybe we'll do this. Let's live. I want a walkable community because we just got back from Europe. And I was like, I want to walk everywhere I go.
Yeah.
So that was challenging trying to figure that piece out. And then I gave in and just, my husband was like, he was going along with this dream that I had that we were going to live in a high rise and this was going to work with the dogs and it was all going to be great.
Okay, honey.
He kept going and he would go and he would visit these houses. He was like, well, what are the things? And then he just started asking questions to like narrow down. And so we finally, he got me there. And, but I think that was one of the things that I noticed, traffic. There's no traffic here when you're from a place like Houston.
Yes, I bet.
Totally agree.
Which is nice. But what's really, really odd is when someone says it takes 20 to 30 minutes to get everywhere, it does, even if you go further. So like if I come I leave like Chesterfield and I come to, I think it's called Brentwood to go to Home Goods because that's where everyone should go.
Oh, risky.
I know.
That part.
Well, it's like I go there and then we go so it takes me 25 minutes to get there and then we go further in town to go eat and then we come home and it still took me 20. It was like, but we drove 15 minutes further, but it still takes you. It's the oddest. I don't know what happens
It's
in
like
that.
the sister of the traveling pants. Is
that what it
just works? Okay. It's just 20 minutes wherever you go.
Yes. But every time you add 8 minutes to it, but if you go straight back, it's still the original time.
Yeah, that's funny.
Fascinating.
Wild,
Yeah, it's convenient.
I love
convenient.
it. Yeah. I mean, I think it's great.
Yeah.
So there's that. I do get honked at a lot here.
Oh,
Interesting.
I don't know if I'm a bad driver or
interesting. Like on the highway or on the back roads? Or?
The most interesting one is to me is the person in front of me honking at me.
Oh.
I don't know what I'm doing.
Are you riding there?
No, I don't think so.
Interesting.
But yes, I get honked at. I've been like, I don't have a protected lane and the person behind me is honking to go, but I'm like, I don't think it's safe.
Yeah.
So and my husband's the same thing. So we text each other and I'm like, did you get honked at today? He's like, yeah. So I don't know if it's Houston drivers.
Maybe I should be paying more attention.
Yes,
Maybe people are honking at me and I don't know.
Sometimes we can be crabby though. I feel like St. Louis drivers can be a little like...
I think those are probably my observations. Weather, no traffic. The food is surprisingly good here.
Okay.
I mean, from Houston, that was my biggest fear of coming to, a Midwest town. And it was like the food was going to be terrible, but we've had some good food.
Yeah.
So
where have been some spots
I think my favorite place so far that I've been a couple of times is the Louis
on Demand.
Yes.
Yeah, that's a great
one.
neighborhood too.
I like that restaurant. Our first dinner, someone invited us to dinner, and maybe it's just kind of nostalgic for me because it was our first dinner with new friends here, and it was. And I had the carrot raviolis, and they were like fantastic.
Ooh, where was that? At Louis. At Louis. Oh, I'll have to try that.
Yeah, they were so good.
Sounds delicious.
And the prosciutto and like cheese, like it was fantastic. So that's probably my favorite.
Okay.
I had a girlfriend come into town, and she likes speakeasies. This is her thing. So I had to text and was like, where can I take someone to? And so we went to a restaurant called Extra Wavy.
Yes.
Ooh,
Uh-huh.
do you know this? You've heard of it? Okay.
It's not a dry bar. What?
I don't.
Raw bar.
Yes.
Raw bar.
Yes. Dry. One of these things.
Gonna get there.
And then there's a speakeasy Prohibition. Down below.
You've been there, right?
So we went.
Gatsby,
so we did that.
Yeah.
Yes,
Yeah.
exactly. That's what it says on the building. I don't know. If
There's
that's
so
the
many.
area of
There's
town.
so many places to explore. It really is, and just every neighborhood is so unique and different. We can, after we record, we can give you some recommendations too.
That's the other thing I probably learned is there's so many municipalities
Correct.
here, which is very different than a Houston.
I think a lot of people find that when they come to St. Louis that like we say St. Louis and then there's so much life happening in these municipalities surrounding like downtown St. Louis,
right.
whether it's the city and the county or, so they each take on like a personality
They
of their
do,
own,
right.
So
They do.
Yeah.
I've enjoyed kind of learning. Like this is where are we right now?
this
We're
is
in
Maplewood.
Maplewood.
Maplewood. And so this is my first time in Maplewood. So it's like all
Yay.
this little, I feel like I was talking earlier. It's like I walk into the Gilmore Girls and
Oh, yes. It does feel a little bit
Yeah.
like that. Yeah.
Yeah.
A little gazebo and
Yeah.
Yeah.
walkable coffee
Yeah.
shops and whatnot.
Love it.
Love that.
So I want to get to my rapid fire questions, if
let's
that's
do it.
okay.
Mhm.
Okay. I've just got a few for you because I know
Okay.
we got to wrap it up. Let's see. Okay. Ooh, I really like this one because you're in a different season of motherhood than the two of us.
Yeah.
What's one word or a couple
Oh.
few, that could describe this season of motherhood for you?
That's a tough one. I would say, I would love to say freeing, but I feel like the guilt hasn't gone away. And maybe it's because I've moved. So I feel I do have, I'm in the guilt phase of wanting to do for myself and feeling like it's okay
Yeah.
because they're not here every day.
You've poured into them.
So yeah, but I think I do. They still need you,
Absolutely.
and so when the phone rings, I don't answer the phone every second. Like right when they call, I'll say I'll call you back.
Sure.
So I think I'm in this. It's this strange guilt phase of still being, and I'm in this in between of where I have parents, my mom that I'm
aging.
taking care
Sure.
of that's aging, and then like you're in this weird phase of life, and you think it's supposed to get less stressful,
Yeah.
less to do, and I think it just gets more. And then they bring more people into your life to care about, and so it's like you just
that
have
is
to.
so interesting.
So it's
yeah.
I think it's harder. So
It shifts. It
Yeah.
never ends.
It never.
shifts.
I know. I'm thinking, oh gosh, so
It
you're telling me
doesn't-
this guilt
It
doesn't
doesn't.
end.
No, it doesn't. And so yeah, I guess that would be my word in my long about rapid fire response to
No,
our question.
I don't think it's easy to sum up anything in motherhood in one word. That was actually not nice of me to give you.
It's like, the guilt doesn't go away.
I think every mother could understand that.
Yeah,
I think every mother listening will understand that.
Really.
Let me just ask you one thing. Let's see. What's bringing you joy right now?
Oh, joy. I would right now it's coming in to a new place and being able to see things through a different lens and having experiences that I can share that are going to help.
Yeah.
I was in one place for so long that I didn't have a lens at all because it was just I was in autopilot. So I think now coming in a new space and being able to look through a different lens is just it's really kind of cool. It's nice to like give a different perspective that somebody hasn't seen, and they're like, oh wow, kind of feel like you like really did something.
Yeah.
So
And I think that's really important for St. Louis too.
Absolutely. I love what you said that you're spending so much time listening. I just think that if we all kind of took on that perspective in life of, turning off autopilot and just listening, to each other, we might be in a different place. So,
agree.
yeah.
Absolutely.
Well, we're so honored that you spent some time with us today,
Oh,
Tricia.
thank you.
Excited to see
Thank you.
your journey with Mercy. So we're so glad you're here in St. Louis and at
Thanks
the helm.
Yes. Thanks for the invite.
All right, St. Louis moms, we will catch you on our next episode.
This episode of the Moms of the Lou podcast was brought to you by Swap the Playroom.
Thanks for listening to Moms of the Lou. We hope it encouraged you and put a pep in your step and helped you get to know our community a little bit better. Be sure to find us on Instagram, STLouis_mom. You can find us on Facebook, St. Louis Mom. You can find us on our website, www.stlouismom.com. In case nobody else tells you today, you're a great mom and you're doing a great job. Chat with you next time.